Hello peoples of YouTube. Quick disclaimer for the video that you're about to watch. There's a little bit of an issue with the sound. We shot at a different location and I feel like the quality of the sound was compromised just because we were at a different location and there was a lot of background noise, and we don't really use lapel mics or anything like that, but we're still getting there. We've not grown to that level. Instead of not uploading the video or trying to reshoot it and foregoing important things that were said, I decided that we'll just go ahead and upload this video as is, because the information that we're going to disseminate is very important. I feel it's not too bad, but I had to put the disclaimer out there, so bear with us for this one particular episode. It's better with earphones on, but nonetheless I think you're really going to enjoy it and it's quite informative.
Was that a little...
Hi guys, welcome to our channel. Hi guys, so we're back today, and as you can see we have a special guest. We are currently at Gilead Women's Center.
Well, good morning, girls.
Good morning, Aunt Lydia.
With Dr. Christopher Obwaka, aka Chrisa.
Wait.
That's him. He's an obstetrician and gynecologist. I've never been able to say that word. He's a gyna. He's also an old friend to all of us. Yeah, me, I've known Christopher for years. Yeah. So he's just the sharp guy in the group. Now for real, I know he's a real doctor. I'm like, I know. Wow. Yeah. Sometime I think it was on Wednesday or Tuesday. I even put out a question on Instagram asking people to send in questions that we can tackle today with Dr. Obwaka. So we're covering women's health and particularly, what do we call it, vaginal health?
Vaginal health.
Yes. All right. So we'll try our best to cover as much as possible. But I'll also leave Chris's contacts in the description box, and also just an FYI, his clinic is at the NSSF Building in Upper Hill. All right. So this is from Anonymous. Oh my God, I love you guys so much. Kindly elaborate on the HPV virus. Are men the carriers of the virus? Is it possible to get it if you have one sexual partner? And how come the vaccine doesn't work if sexually active? I know I said it in the last video, but I got some comments. People were like, oh, nowadays you can get a jab even after you become sexually active.
Okay. So HPV, human papilloma virus, is a virus that has been associated with cancer of the cervix. And not only cancer of the cervix, some types cause what are called warts. Have you heard of warts?
Yeah,
genital warts, yeah. So there's different types of HPV. There's high-risk types which lead to cancer and low-risk types which lead to genital warts. Almost everybody who's sexually active has HPV. I'm sure if we do the test here, we all have HPV.
Okay.
But having HPV and developing cancer is not a straight line. Like it may take even 10 years to develop cancer from HPV, and you may have HPV your whole life and not develop cancer. So cancer is not one thing, like you have HPV, you're going to get cervical cancer. There are vaccines. There are 3 types of vaccines that cover different numbers of the HPV types. So there are vaccines that will protect you from warts and cervical cancer. There are some which will protect you only from cervical cancer. However, so the vaccines are usually given very early for both boys and girls. So for the girls, we'll give 7 to 9 years. You can give it up to the age of 26 if you're not been sexually active. Like if you're a nun or you're a virgin, then you can get it as late as 26 years. Then for the boys, around 10 to 13 years. So men are carriers of HPV, but rarely do they get any symptoms. But they can transmit it because it's sexually transmitted. So a man can have HPV and give it to the woman, and the woman can go on to develop cervical cancer. But the men, as usual, we don't suffer from these things. We just make the women suffer.
That's interesting. I didn't know there's a vaccine for boys.
Yeah, there is a vaccine. So the vaccine ideally is supposed to be given to both boys and girls, because you can give it to the girls only, but the boys are still spreading, so to speak, the virus. So like in industrialized countries or third world, first world countries, then both boys and girls would get it. So you're having a generation of kids growing up who are all vaccinated.
My question is, because I think we're assuming, so sexual, when we say when you're sexually active, it means penetration of a penis in a vagina or
any
oral or
genital,
what, any genital touch.
Genital contact, so whether it's, I don't know, scissoring or you can have HPV also in lesbians as well. So it's not only men.
You can transfer from a lesbian. Men are the carriers, but you know.
I mean, women also have it. So if a woman has it, she can give it to her lesbian partner, for example.
Okay.
Yeah. So any genital contact.
I'm done.
So if you get the vaccine, you don't start. You don't have early sexual debut, you don't have multiple partners, you're HIV negative, then all those things work together to reduce.
So as we are beyond health. Is that
Can we get the vaccine now?
So when you're much younger, then you can, I mean, many of the younger people, they get the HPV, but because the immune system is very robust, then they clear it. As opposed to when you're older, like above the age of 26. That's why it was put a cutoff of 26. Before that, they're likely to clear it. So you may have it, and then after 3 months, then it's been cleared from your system by your immunity, the immune system. But above the age of 26, it's likely that if you have it, you have it, and you may not be able to clear it. But there is a test. There's a test for HPV.
But there's no test for men.
There's no test for men, unfortunately. Not that has been.
So you just have to.
You just have to hope.
how much is the test?
So it's about between 3,000 and 6,000. The HPV test depends on where you do it here.
And how much is the vaccine?
The vaccine, we give it at the clinic as well. So you can get at any clinic, you can get at any hospital. It's a series of, depends on the vaccine that you get, either 2 or 3 jabs. So like you get now, some after a month, then 6 months, others after 3 months, then 6 months. So that puts you back maybe 10,000 more. So it's, I mean, it's quite affordable if it's something that's going to prevent you from getting cancer. Because the cost of getting cancer is, I mean, it's
ridiculous.
I don't think I don't think I had an answer. So can we get the vaccine?
So okay, what would start with is the test. So do the HPV test. You may have been sexually active, but by some miracle of your immune system, it has cleared it. So if you don't have the high risk HPVs, then you can get the vaccine. But if you already have, then there's no benefit. You can get, but not much benefit.
So that means what we wait to die of cancer.
Now you do the regular pap smears.
You do the regular pap
So the pap smears catches it before you can see it with your naked eye. So like when it's still microscopic, like cells. So if you do like a pap smear every 3 years, that's what's recommended now. Before it was yearly. What I recommend is you do like 2 years, like this year, next year. They're all good. And you're not HIV positive, you don't have multiple partners, do every 3 years after that. Oh, there's a home HPV test as well.
Oh!
I can
give us some. Show us.
I think not expensive, you've just opened it. Money.
Even send me clients, so it's fine.
Brush.
There you go.
You're missing the lesson.
I'm being told to do demos here by Lonzi. She's giving me demos.
So this side looks soft plastic with a soft brush inside. So this is what you will insert into your vagina until that point. And then you just push it up and then rotate it thrice. And then it comes down, you seal it and send it to the lab. So you do it at home. I mean, you can do it. You can go to your washroom in your office and do it 2 minutes.
No, that's perfect. When my baby is, how much is it?
You can get it from Lancet, you can get it from Nairobi OC. So from Lancet, I think comes to about between 4,000 and 6,000.
Jesus Christ of Nazareth.
For everything, that's the test and the brush.
Then I was like, just this thing. Then I slept for the lab.
If you're shy or you have bad experiences and you don't want to go to a doctor, then you can do this at home.
So, is it true that birth control pills affect your fertility later on? Is it true that birth control pills affect your fertility later on?
No. The pills, no. If used correctly and you don't have any underlying issues in terms of hormonal imbalance, problems with your ovaries or your uterus, or your tubes or the sperm count, then it should not affect your fertility.
I don't enjoy sex. I have gone to the hospital, done pap smear, and still every time we start romancing and almost doing it, I stop him. I feel bad because he questions himself a lot, though I tell him I want us to wait until we get married, but deep down, I feel bad because I want to also enjoy and feel the amazing orgasm that people talk about. I need advice on what to do. Also, I experience some pain when he penetrates, but maybe it's because I'm nervous.
I think her last word is the diagnosis. Yeah, there's this psychological, the nervousness.
Really?
So sex is largely psychological as well, as much as it's physical. So it's psychological in terms of arousal, in terms of being relaxed enough, in terms of enjoying, in terms of orgasm. All of it comes from her. Going down.
Amen.
The biggest sexual organ is the brain. So we usually now try and trace back, look at the childhood and growing up. So if any evidence of sexual abuse, any history of physical abuse, any body shaming, that's a big thing as well. Some people are told nobody should look there, it's your private organ, it's a dirty organ, Then they grow up knowing that, even when they're down to be intimate with a man, like it's not supposed to sit there, put off the lights, don't go down on me, that kind of thing. A lot of it is psychological. So the pain during insertion is called vaginismus. Some of the time it comes because of contraction of the muscles. So when the muscles tighten, then of course it's going to be painful. If it's painful, you're not going to enjoy it. And you won't orgasm if you're in pain, or if you're feeling embarrassed or shy, or guilty about anything. It depends on how you've been socialized. So the first step for them would of course find out what's the trigger, what happened in your past, or what's happened recently that's putting you in this situation. And then psychosexual counseling. There's lots of sexual counselors or psychosexual counselors or psychologists that now can walk you through that, to accepting yourself, forgiving, whatever, healing from any trauma that you had previously. And then now sexual aids as well. So, things like water-based lubricants like KY, and they can help with the vaginismus as well. And of course, ruling out infections.
Infection, yeah, because I was thinking maybe it's an infection. Because, penetration is not supposed to be painful. In fact, at the beginning, is the best part.
Yeah.
If you feel pain, there's gotta be something wrong somewhere.
So if you rule out infections and other medical things, then now look at the psychology of it, and then now just, because you have to treat a patient as a whole, you can't just say, take this KY and go.
Can you close up your vagina and lock up and take inside?
It can happen. The muscles are very, very powerful.
Really?
You've seen it in the news, eh?
I was like, this actually happens.
People in the logic and all that,
Like they get stuck. It's not like a dog. You get stuck.
So sometimes it can be so bad that they have to come to hospital, and then we have to give the lady a sedative. So that the muscles relax, so that they get.
And that is his. That should work.
You never hear it happening with like husband and wife. It's always in a lodging, somebody doing something.
It's like a logical thing.
So they use it
We apologize for the sound, guys. But it's very important information.
So are there situations where there are women whose hymens have never been broken?
It is possible.
And maybe that's why, I don't know.
So the hymen it's an interesting organ. First of all, you don't only break your hymen through sexual intercourse. That's a very important thing to know. So if you're an athlete, for example, if you exercise, the hymen can break just because of that. If you do bike riding, if you do horseback riding, then the hymen can break. So not everybody whose hymen has broken has been sexually active.
Is it healthy for the reproductive system to have babies at a white cap, say 15 years? So a baby at 20 and a baby then at 35.
30. So usually the 10 years is sort of the magic number. If you have a baby now and then another baby 10 years, then I don't know if the body forgets. It's easier if you're having a baby this year, then after 3 years, then the pregnancies and the deliveries become easier.
Really?
But what we have seen is if you have a very big gap, then it's like you're a first-time mom again. So all the symptoms are accentuated, and the delivery is also problematic. And if you have your first child at 25, then 10 years, that's already 35. If you have at 28, then 38,
So you're
then
already problematic.
the risks with age, high blood pressure, diabetes, risk of going for CS, malformations, all those increase with age. Yeah, so it's definitely, everything is easier when you're young.
Okay. But I mean, is there anything that gets better with age sexually? Like honestly, is there anything?
Experience maybe.
Oh, okay, so you know what you want.
Style.
So like age is like age is the villain for us, like
For women.
For fertility and delivery. Yes,
fertility and delivery.
But I think, sexually you become more liberated. Gets better with age, and maybe you've been one partner for a long period of time, so you understand each other.
When you're feeling something, pop home, big HPV test.
And it's good.
He'll even do it for you.
Let's do this thing 3 times.
Since we're talking about that, what would you say is a late age for a woman to have a child? Or when should they start thinking, like you need to put a baby inside you because, because like you're saying, a lot of us are working, we're doing things and we're like, there's pressure for you to do stuff.
Sometimes also the men are not there.
So
35.
35.
Yeah, 35 is somewhere around the magic number. You would still conceive after 35, but the risks increase.
So by that time, have it already done?
At least you've started.
On your 35th birthday, you should be pushing. I should be done.
No, she's saying that's when you should at least start. That's the latest you can start.
Yeah,
I thought that is the latest.
No.
Ideally, you should end.
No.
End, not start.
No, he said start.
No, he said end.
Have your last
Okay,
baby.
because your starting can be your finishing depending on how many children you have. So like, maybe if your desired family size is 2, then maybe you have 30 and then 34, that kind of thing.
And then is it true that there's a trend, or rather, what the landscape is looking like now? A lot of women are it's harder for women to get pregnant now, even before that 35, than back in the day. I don't know if it's a lifestyle thing, because there's a friend of mine who told me she went to a doctor, and the gynecologist told her, like, I'm making money off of fertility rather than just people coming in for checkups and whatever. So there's an issue.
Lifestyle plays a big role in conceiving as well, in your fertility. So we're drinking more, we're smoking more, not pointing fingers, we are eating more junk food, more processed foods, more chemicals in our foods and drinks, and what else are we doing? Of course, we're delaying childbirth, we're getting children later, and then infections. So we're more sexually liberal, and we're not on family planning. We're using P2 more. That means unprotected sex more. So you can have chlamydia or gonorrhea with no symptoms.
Yes,
but
because people tubes block. I've heard of
So
then you
don't have symptoms.
You don't have symptoms, and then you're told you get an ectopic.
So if your tubes are blocked, the risk of ectopic is high. If your tubes are blocked, conceiving is also dramatically harder.
Is it true if you drink pineapple juice or eat pineapples, your flour taste and smell like pineapples, and also increase your yeast infection?
Increase or decrease? So whatever you take into your body then permeates to your whole system. So if you take, like garlic, then you may taste of garlic. If you take pineapples, then you may taste of pineapples. Cranberry juice helps with UTIs. So your diet plays a big role in urine infections and vaginal infections as well. Pineapple juice being associated with increased yeast infections, I've not heard about it.
Because of the sugar?
I've not heard about that. Because
you
only have increased yeast infections if you have diabetes. So maybe people extrapolate, diabetes, high blood sugar, and taking sugary things, but there's no line between sugar intake and recurrent yeast infections. It's more likely if you have diabetes, then also your immune system is low, then you're likely to get recurrent infections.
It's the same way with man semen.
As well.
Still thinking.
That's a question for you for later.
How did some people so what you eat determines I guess the taste of your secretion.
Secretion.
sweat.
Yeah,
So you feel like when you drink, then you sweat smells.
Okay. Yeah.
If you eat something very garlicky,
Yeah.
then the sweat will smell.
Yeah.
So secretion
Walk around
is
smelling like curry.
Yeah.
Okay.
Like stew.
Yeah.
Strong.
Hi guys, I love your show. My question is, can you get candidiasis from your partner if you have unprotected sex, and taking into consideration that yeast is present in a healthy vagina anyway?
So there's something called normal flora. Normal flora is the normal bacteria or biota that you have in your system, in your mouth, your normal flora, in your armpits, in your vagina, in your anus. So there's a balance. So there's good bacteria and bad bacteria that you have. So if the balance is off, then now you're more predisposed to getting infections. Candidiasis itself is not sexually transmitted per se. Men are carriers most of the time asymptomatic. The only time I've seen candidiasis in a man is if he's HIV positive and it's quite advanced, so they get candidiasis of the throat, and you can get candidiasis on the, where the foreskin used to be. It's called balanitis. So we don't frequently treat the man as well, because men, it's not considered sexually transmitted. Yeah.
Also, the man does not get a yeast infection.
No, men don't get yeast infections. Yeah. So we usually just treat the woman, and then now we advise on the other things that can reduce the risk.
So you can't keep getting it back from your partner if you
It's quite unlikely.
Okay.
It's quite unlikely. Yeah.
So just to be clear, the candidiasis she's talking about is a yeast infection.
Yeast infection is the same as
candidiasis.
candidiasis. Yeah. It's the most common yeast infection. There's many different types of
candidiasis
yeast.
is the type of the...
It's called Candida albicans.
Albicans.
So it's the name of the fungus or the yeast. Yeah.
All right, this nice lady has asked about safe days.
Yeah. Yes.
Safe
Okay.
days. Pull out.
I want to do it.
Yeah.
About safe days. So,
So
what is she
safe
asking?
days is the time in your month when you're least likely to conceive. It depends on several things. Depends on your cycle length. So some people have a cycle length of 21 days. Like every 21 days your period starts. Some people have up to 35. So 21 to 35 is normal. So 21 is short but normal. 35 is long but normal. In between about usually 26 to 28 days for most people. So what you do, you take the first day of your period minus 14 days. That's your date of ovulation. So safe days, you also have to understand how long sperm can last in your system and how long your eggs can last. So sperms can last even 3 to 4 days in your system.
Yeah.
So you can have sex 4 days before your ovulation and still conceive.
From that sperm,
From
4 days ago.
Really one
So sperm
Yeah, so they so determined to...
Hey, the couple.
It's their only job really.
So you can imagine 3 to 4 days. So today is Saturday, you could have had sex on Wednesday, and no sex on Thursday, Friday, no sex today, and you ovulate tomorrow and conceive. So now you see, when you're thinking about safe days, it's not only your day of ovulation, so you have to give yourself a window for ovulation. So safe, like maybe you give yourself 5 days before your ovulation date.
5 days before your
5 days
ovulation
before.
days. Yes, that's what I was going to ask.
And then your eggs, now for the ladies, last about 24 hours. So if you ovulate today, then a day or two, then the egg is not viable for conception. So if you give yourself 2 or 3 days after your ovulation, so you have like a 7-day kind of window, which is your safe days. So
We are good.
Yeah.
So sperms last 4 days inside your body. Can you conceive children from 2 different fathers?
Yep.
Wait, so you can have twins from Baba A and from Baba B?
If you have 2 eggs, because you have 2 eggs, because you only drop 1 egg a month, right?
Not everybody.
Yeah.
Some people ovulate from both sides, and some people ovulate twice in a cycle. So there are people, it's called super fecundity, like you're super fecund.
Wait,
That's what makes me
I mean, so you've seen even cases where, people thought they were twins, but one is black and one is white.
I thought it was just on the internet.
And they're genetically related because it's the same mom. Different fathers.
Yo!
So you can have
That's crazy.
sort of twins, but they're just days apart.
That's so crazy.
So it is possible.
Yeah.
Maybe she was lonely.
Yeah.
And this guy,
Maybe she was on like spring break. Or
maybe she was in a relationship with a white guy, and then then they cosanad.
Yeah,
And then she went out.
The best friend.
Then she went there, but she was like, you know, I will love you.
I don't know what just happened. That is crazy. That is crazy.
Stranger things have been known to happen.
What is the coolest, strangest? What is the strangest case you've ever seen?
Oh, what have I seen? I mean, triplets and quads are always very interesting. What else have I seen? You can have an ectopic pregnancy and a normal pregnancy at the same time.
What does that even mean?
That's the same
One
way.
had a fallopian tube.
Yeah,
And
that has got
at least 2 eggs. So one egg goes and implants in the correct position, one egg implants in the tube.
Guys, so you have to take her down to remove the ectopic while still
And then the pregnancy, the other
Can
pregnancy.
continue.
Yeah, can
Okay,
continue.
okay.
Yeah.
You're crazy.
I was going to ask you something.
Okay.
Women who are stitched during
where?
pregnancy in their
After being
vagina.
cut.
because
Oh, okay,
they're
after
told-
normal delivery.
No, stitched so that the baby does not come out.
fall out.
Oh,
Come out.
okay.
What's that about?
Yeah,
I know it's
called a
because
McDonald's stitch. Mac stitch.
short because of short cervixes and stuff.
Yeah, so if you have it used to be called an incompetent cervix, but that's not politically
Yeah.
correct.
That is
Yeah,
not nice.
what do you mean my body is incompetent?
Incompetent.
Yeah. My cervix is
So it's called cervical insufficiency now. Like it's not, either the length is insufficient or the strength of the cervix. So what happens with those, like once you get into your second trimester, the weight of pregnancy is increasing, the weight of the pregnancy itself, then you have painless opening of the cervix, and you get a miscarriage because the cervix couldn't hold the weight of the pregnancy. So we usually put in a stitch.
I had even in those stitches you can't have sex, and even if you you can't and you can't even like you can't orgasm, you can't say okay we can't have sex, so let me play with you, let your husband play with you. Like
But
if
you
you
get
orgasm,
Yeah.
you funga the stitch will open.
But it's coming.
Not strictly speaking. I mean, orgasms and sperm, then they release, the feel-good hormone is called oxytocin.
Yeah.
Oxytocin can cause contractions of the uterus.
Yeah.
So in some people you can get preterm labor, but we only restrict the sex shortly after the stitch is put. Just chill and heal fast.
Oh, but after that you can enjoy yourself.
Yeah, after that.
But if you want your baby to come out soon, you need to enjoy yourself.
I mean, sex is one of the ways of
I get it.
dreaming about labor. Yeah. If you don't want to diarrhea, if you don't want castor oil and diarrhea, then sex is one.
What have you just said?
If you don't want castor oil and diarrhea, then your diarrhea.
What did you say?
One of the ways of induction of labor, like a home method, is castor oil. So you drink castor oil and you have diarrhea until you go into labor.
No, let me just
Because
have
diarrhea
sex.
will also now stimulate your uterus to contract. So those are people who don't want, the formal induction, like tablets and drip and all that stuff.
Oh, they're natural.
That's like a natural way.
I think it's too natural for me. I think that's too much.
2019, guys. I'm sure we can find another
Even
way.
now there are women drinking castor oil. Like they watch this, somebody drinking castor oil.
Just not her own.
All right, thanks, Dr. Christopher Obwaka.
Welcome.
Yeah.
I said this is Gilead Women's Center. It is in NSSF Building in Upper Hill, basement block A.
Block A.
Block A, basement one.
Yes. So thanks, Krista, and we
Most
hope.
welcome. It's nice to have you, of course.
Yes,
Yeah.
thanks for hosting us and giving us juice and biscuits
And
water.
Yeah, in this sun. Wow.
Yeah, and we hope that this information is helpful to many people. If you need to make an inquiry, please reach out to him. Alright? Okay, so have a lovely week and adios. Bye.
Over 25, subscribe.